I've been told we have one more person. Okay, now we have everyone. Good evening, everyone. My name is Dr. Jacqueline Barris. I am the Assistant Dean of Clinical Education. I am the Director of our Spine Care Department for SCU Health, and I am the Acting Dean of Los Angeles College of Chiropractic. Welcome to our Summer 2022 White Coat Ceremony. We are very happy to be hosting this special occasion in person and with guests. This is the first time that we've done this since the beginning of the pandemic. You can find the event program using the QR codes that were provided at the doors. And because this is our first indoor event since the start of COVID, we did limit attendance as a precaution. For that reason, the ceremony is being streamed live on our SCU YouTube channel. So for those that were unable to attend, please make sure that they have the link so that they can join along with us. Before we begin, I'd like to acknowledge the people that helped to make this event possible. President of SCU, Dr. John Scaringe. Tessa Bowen, Amy D'Onofrio, Alicia Watt, Joseph Eggleston, Julie Gonzalez, Kelly Gallo, Autumn Katzman, Sam Sadre, Nick Oyenyo, and SU Campus Safety and IT. Thank you as well to the ASB who provided the decorations for tonight's ceremony. This momentous occasion celebrates our students' accomplishments as they transition from their academic to clinical training. Going through a doctorate program is not easy, especially during such challenging times. These students have truly demonstrated one of SCU's values, determination. Clinical students, we are very proud of what you have achieved thus far, and we look forward to the growth that you will attain during the next year of your clinical training. Thank you to those in attendance tonight, both physically and virtually, for supporting these students through their journey. I would like now to introduce our esteemed faculty on stage. Our keynote speaker, Dr. Joseph Horrigan, Executive Director of Tactical Sports Medicine. Introducing our keynote speaker, Dr. Sunny Nilchevi, Lead Instructor of the Chiropractic Clerkship Course Series. Announcing our students, Dr. Kirsten Sparley, Supervising Clinician for the Sports Medicine Department. Our coders, Dr. Felix Lee, Assistant Professor for the Clinical Education Department, and Dr. Diane Christofferson, Clinical Instructor for the Clinical Education Department, who will also be reciting the clinical clerkship oath with our students. And of course, I would like to welcome our guests of honor, our clinical students. I would like now to bring Dr. Sunny to this stage to introduce our keynote speaker.
Thank you, Dr. Barris. And welcome everybody. Thank you so much for being here, especially the family for your support. You're a student. It is very much my honor to talk about Dr. Joseph Horrigan, who is here for our keynote speaker tonight. Joseph Horrigan, Doctor of Chiropractic, Diplomate of the American Chiropractic Board of Sports Physician, has spent a career in multidisciplinary practices with sports medicine and sports performance. Dr. Horrigan was a partner at the Disc Sports and Spine for 11 years and was the only DC amongst spine, orthopedic surgeons, as well as pain management and physical medicine and rehab specialists. Other interdisciplinary experiences include a fledgling spine program at Century City Hospital and work with the West Coast Center for Orthopedic Surgery and Sports Medicine. Dr. Horrigan's private practice, the Soft Tissue Center, was affiliated with all of these above groups that I just mentioned. This collective experience and education allowed him the opportunity to work with the USA Weightlifting Sports Medicine Committee for 8 years, consult for the USA Track and Field in their Elite Hurdle Development Program, and to be the director of the DISC U.S. Olympic Committee Sports Medicine Official Provider Program for the 2012 Olympic Games, and staff doctor for the Red Bull High Performance Program from 2011 to 2016. Dr. Horrigan also served as a head strength and conditioning coach for the Los Angeles Kings from 1999 to 2002. Dr. Horrigan has been published in several journals, including the Medicine and Science in Sports and Exercise, and has made presentations at the American College of Sports Medicine Conference, the AACBSP Chiropractic Sports Science Symposia, American Orthopedic Society of Sports Medicine, the 6th World International Olympic Committee Congress on Sports Science, and the International Association of Chiefs of Police. Lay publications include the monthly sports medicine column for Ironman magazine from 1989 to 1999, and from 2004 to 2014, and a contributing blog to the Huffington Post from 2012 to 2017. Dr. Horrigan has taught in chiropractic sports medicine since 1994 and has taught third-year chiropractic students in neuromusculoskeletal differential diagnosis since 2005. He is also contributing to the redevelopment of the curriculum. The current project and effort in the development and expansion of the SCU Tactical Sports Medicine and Tactical Strength and Conditioning Program. A pilot study is currently underway with the Los Angeles Sheriff's Department Academy to evaluate predictors of injury in the recruits. The SCU Tactical Department is truly integrated and patient-centered care. Dr. Horrigan continues to consult for the film industry in both sports medicine and sports performance. The most notable films include The Matrix, The Hunger Games, Seabiscuit, The Hateful Eight, The Skeleton Key, Charlie's Angels 2, Sicario, and Django Unchained. It is truly my honor, everyone, to introduce our summer 2022 White Coat Ceremony keynote speaker, Dr. Joseph Horrigan.
Thank you. I'd also like to take a moment to thank Dr. Jacqueline Beres for organizing all of this event. She's been working very hard on it. Thank you. So until the late 1800s, black was usually worn by doctors in healthcare. It was considered to be very similar to the clergy and to the priests, that it was a very serious matter with their patient encounters. And it was considered to be very formal, which to this day it still is. But in the late 1800s, the white dress, the white coat, began to become a little bit more prominent. And by 1900, it really gained a lot of momentum, and the momentum continued until 1915. Students, residents, fellows, doctors and nurses wore white in North America. The change and the effort was to try to reproduce the most recognizable symbol in science, the white lab coat. That was the goal. So the white coat ceremony began at the University of Chicago in 1989. A much more robust ceremony occurred at Columbia University in 1993. By today, it's routine in all healthcare universities. It's a sign of personal transition for you, from student to doctor, with a high degree of professionalism and empathy for your patients. And as it's continued, it's a worldwide phenomenon now. So today, special meaning for you. If you remember back in differential diagnosis, yeah, laugh, go ahead. You can now. I asked you to look in the mirror. And I asked you to, when you look in the mirror, that you see a doctor, that you no longer see a student, because you were already in transition. Because a doctor has different responsibilities than a student. A student sees skills as tasks that have to be mastered and to pass a class. A doctor sees people as patients that need care, that need to be evaluated, that need help with their pain. The white coat for you is a transition to your commitment of care and to your clinical duties. So when we have you in clinic, you're not done with us yet. When we have you in clinic, we're going to push the limits of your knowledge with case scenarios, efficiency of your history and examination, case management, and ethical decision making. So we've discussed attentiveness to patients. People are seeking your help because they're in pain. We've always discussed diversity amongst our patients. And we will provide care to any patient regardless of their race, ethnicity, religion, sex, gender identity, sexual preference, immigration status, or station in life. Very soon, you're going to take an oath that you're going to swear to provide care to those who ask you for care. SCU has always been a diverse culture. That was the case when I was a student here, 300 or 400 years ago. Doctors at SCU and students at SCU look at health a little bit differently. They look at healthcare delivery a little bit differently. It's part of who we are. It's embedded in us. We see the world a little bit differently to everyone's benefit. So the message today has been very serious because health care is very serious. Pain is disruptive. Pain can be destructive to people's lives. Today, however, is a very important day for you. Each of you has a story as to how you arrived here. I have a story too. And our stories brought us here today. Here we are together. And our stories aren't finished. They're still being written by us. They're still being written and will be written by your patients. They're being written by your faculty and administrators and by our individual and collective experience. You are to be congratulated. It took a lot of strength and fortitude to make it this far. The journey has not been easy, has it? Yeah. The laughter, and I see all the heads shaking. to our clinical students in the audience, to their parents, spouses, significant others, siblings, and even children. We need to take a moment to recognize this ceremony, to this step in your life. It's very important. You need to celebrate. You need to take a lot of photos tonight. Remember this moment. Remember the ceremony and the stage that you've reached. The donning of the white coat is not an end point. It's just the beginning of a wonderful career in healthcare. You are our future. Thank you. I would now like to ask the following individuals to come forward for the student white coat presentation. Dr. Kirsten Sparley will be announcing their students. Dr. Felix Lee and Dr. Diane Christofferson will be coding our students. Thank you, doctors.
All right, so will the students of the Doctor of Chiropractic program please rise and come forward to receive your white coats. David Howard. Andrew Gomez. Emmanuel Gomez. Daniela Velasquez. Sydney Stevenson. Hannah Necker. Irani Shanuda. Renee Gladstone. Heath Crawford. Tanner Juritsma. Justine Reyes. Neil Calabrese. Michael Collins. Arthur Crockham II. Mark Herrera. Omar Guido. Allison Menendez. Kennedy Root. Marlena Borst. Heidi Bansberg. Jose Landine. Mark Constantino. Jason Locke. Isaac Martinez. Shane Bauman. Nicholas Tawa Esse. Ashley Fiala. Kyle Simkovich. Jason Hull. Caleb Bryant. Philip Lee. Christopher Norio. Tyrone Balukanug. Christopher Hidalgo. Amy Fang. Ashley Rosano. Farshad Rabar. Maziar Masumian. George Rodriguez. Kyle Ornelas. B. Dip. Anna Nguyen. Tanya May Reyes. Marta Blankenship. Minas Monasia. Karina Miller. Christina Huin. Savan Toshkian. Michael Sammy. And now I would like to invite Dr. Diane Christofferson, our supervising clinical faculty member, to eventually deliver the clinical clerkship.
All right, after that, will all students entering their clinical clerkship please rise, raise your right hand, and repeat after me. Now, as I transition into clinical clerkship, I solemnly promise that I will, to the best of my ability, serve humanity, caring for the sick, promoting good health and alleviating pain and suffering. I recognize that the practice of my discipline is a privilege, with which comes considerable responsibility, and I will not abuse my position as a student. I will train with integrity, humility, honesty, and compassion. Let's do that again. I will train with integrity, humility, honesty, and compassion. Working with my supervising doctors and other colleagues to meet the needs of my patients. I shall never intentionally do or administer anything to the overall harm of my patients. I will not permit considerations of gender, race, religion, political affiliation, sexual orientation, nationality, or social standing to influence my duty of care. I will assist my patients to make informed decisions that coincide with their own values and beliefs. And I will uphold patient confidentiality and professional ethics of practice. Ethics of practice. I will recognize the limits of my knowledge as a clinical clerk. And will seek to maintain and increase my understanding and skills by confiding in my supervising doctors and other colleagues. I make this declaration solemnly, freely, and upon my honor. You may be seated. And now I ask Dr. Barros to please come to the podium.
Well, that was a memorable moment, wasn't it? This concludes tonight's ceremony. Thank you again to those in attendance this evening, and congratulations to the newest members of our clinical team. I look forward to working with you in the clinic and seeing you grow in your clinical endeavors, working with our patients, and best wishes to you this term and in the terms to come. This is going to be a really fun year for you guys, so good luck to you. Thank you to our guests, and good night. If you could all remain seated until the students leave, thank you. There are some light refreshments that will be served after the ceremony outside.
be ordered.